Your liver could be silently screaming for help, and you might be missing all the signs. Most people don't give their liver much thought until it's too late, and that's because liver damage doesn't always start with pain or obvious symptoms. In fact, some of the earliest signs are so strange, so unexpected, that we dismiss them altogether. You may think it's just fatigue, a skin issue, or a minor digestive problem. But what if I told you that these could be your liver's quiet way of saying, "I'm struggling"? The liver is one of the most vital organs in your body. It's like your personal detox powerhouse, filtering toxins, producing bile for digestion, managing hormones, and storing essential nutrients. Without your liver, your body simply cannot survive. But here's the problem. When the liver begins to suffer, it doesn't always shout. It whispers, and unless you know what to look for, you might not notice until real damage has been done. Today, we'll uncover 12 of the strangest, most overlooked signs of liver damage. So stay with me, because understanding these signs could make all the difference in protecting this amazing organ, and ultimately, protecting your life. Let's begin. Your liver sits quietly under your ribcage on the right side of your body. It weighs around 3 pounds and performs over 500 essential functions every single day. It filters the blood coming from your digestive tract, detoxifies chemicals, metabolizes drugs, breaks down fats, and even helps with hormone regulation. It's like a multitasking factory that works 24/7. But the liver is also humble. It won't complain right away. It has a remarkable ability to regenerate and keep going, even when damaged. But if we don't pay attention, chronic damage can creep in, leading to conditions like fatty liver, hepatitis, fibrosis, or even cirrhosis and liver cancer. Now let's look at the 12 weird signs your liver may be crying out for help. Sign 1. Itchy skin. Itchy skin, especially without a visible rash, can be one of the earliest warning signs of liver trouble. This happens when bile, which is supposed to flow from the liver into the digestive system, begins to accumulate in the bloodstream due to liver dysfunction. These bile salts irritate nerve endings beneath the skin, causing an intense, persistent itch. People often feel it most on the palms of the hands, soles of the feet, or limbs. It's commonly mistaken for allergies or dry skin. But if the itch doesn't go away and is worse at night, it could be your liver sending a message. If you notice chronic itching with no clear cause, don't ignore it. It may be worth getting a liver checkup. Sign 2. Dark urine. If your urine looks darker than usual, especially deep amber or cola-colored, despite drinking enough water, your liver might be struggling. This change in color is often due to excess bilirubin, a yellow pigment formed by the breakdown of red blood cells. When the liver is damaged, it can't process bilirubin properly, and the pigment builds up in your body. The kidneys try to excrete the excess, darkening your urine in the process. This sign often appears before more obvious symptoms like jaundice. So if your urine is consistently darker than normal and it's not related to medication or dehydration, it's a good idea to speak with a healthcare provider. Early detection of liver dysfunction can help prevent serious complications. Sign 3. Chronic fatigue. Liver-related fatigue isn't just regular tiredness. It's a deep, persistent exhaustion that doesn't go away even with rest. This happens because the liver is responsible for converting food into usable energy. When it's not functioning well, your body doesn't get the fuel it needs. Additionally, the buildup of toxins that a damaged liver fails to filter can impact brain function and overall vitality. You may feel like your body is heavy, your mind is foggy, and your energy is completely drained. Many people brush this off as stress or aging, but if this type of tiredness becomes a daily struggle, it could be your liver whispering for help. Don't ignore it. Investigating the root cause could restore your energy and your health. Sign 4. Easy bruising. If you find yourself bruising easily from the smallest bump, or sometimes for no reason at all, it may be due to a weakened liver. The liver produces essential proteins that help the blood clot properly. When it's damaged or inflamed, these clotting factors decrease, making you more prone to bruising and even bleeding. It's a subtle change, but over time, you may notice purple or blue marks on your arms, legs, or other parts of the body. This is particularly common in conditions like cirrhosis or hepatitis. While a single bruise isn't a concern, frequent unexplained bruises can be a sign that your liver isn't supporting your circulatory system properly. It's best to have this evaluated. Sign 5. Bad breath. Fetor hepaticus is a distinct, musty, or sweet-smelling breath that can develop in people with serious liver disease. It's not the kind of bad breath caused by poor oral hygiene or food. Instead, it's due to the liver's inability to remove sulfur-containing compounds from the blood. One of these compounds, dimethyl sulfide, escapes through the lungs, producing a smell that's sometimes described as dead mouse or rotten fruit. It often accompanies other signs of liver distress like fatigue, yellowing eyes, or confusion. Most people don't recognize the smell on themselves, but family members might notice. If regular dental care doesn't fix the problem and you're noticing other symptoms, it's wise to have your liver enzymes tested to rule out hepatic concerns. Sign 6. Swollen abdomen. If your belly begins to swell, especially if it's firm and uncomfortable, it could be a sign of ascites, a condition where fluid builds up in the abdominal cavity. This happens when the liver is so damaged that blood flow becomes restricted, causing pressure in the veins and leading to fluid leakage. It's often seen in advanced liver disease like cirrhosis. This is different from everyday bloating. Ascites tends to cause a tight, heavy feeling and may worsen over time. Sometimes it's accompanied by swelling in the ankles or legs. This fluid buildup can also lead to difficulty breathing or eating. If your waistline suddenly increases without weight gain, don't delay. This sign means the liver is under serious stress and needs medical attention. Sign 7. Yellowing of the eyes or skin. Jaundice is one of the more recognized signs of liver trouble, but many don't notice it right away. It occurs when there's too much bilirubin in the blood, a byproduct of red blood cell breakdown. Normally, the liver filters it out and helps eliminate it through stool. But when the liver is damaged, bilirubin builds up, turning the skin and the whites of the eyes yellow. The eyes often show it first. Jaundice may also come with dark urine and pale stool. It can happen due to hepatitis, alcohol damage, bile duct obstruction, or liver failure. If you notice even a slight yellowing, get it checked. It could mean your liver isn't able to keep up with detoxification, and early diagnosis can save lives. Sign 8. Red palms. Bright red palms, especially at the base of the thumb or pinky, might look harmless, but they can be an early warning sign of liver damage. This redness is called palmar erythema and is often linked to changes in hormone levels due to poor liver function. When the liver is unable to break down estrogen properly, excess estrogen dilates blood vessels under the skin, leading to the reddish appearance. It's usually symmetrical, both hands show it, and is not itchy or painful. While red palms can also occur during pregnancy or due to genetics, it's worth noting if it appears later in life alongside other symptoms like fatigue or dark urine. A simple blood test can reveal whether liver function is the cause. Sign 9. Changes in stool color. Your stool color says a lot about your digestive health. Pale, gray, or clay-colored stools can suggest a lack of bile in your digestive system, often due to liver or bile duct problems. Bile gives stool its brown color, and when bile flow is reduced or blocked, stool becomes lighter. This can occur in liver conditions such as hepatitis, cirrhosis, or gallstones. You might also notice the stools are greasy or float due to poor fat digestion. While one odd stool isn't alarming, repeated changes in color, especially combined with dark urine or jaundice, deserve medical evaluation. Your body is telling you that fat metabolism and detoxification are impaired, both of which rely heavily on a healthy, functioning liver. Sign 10. Spider angiomas. Spider angiomas are small, web-like clusters of dilated blood vessels that appear near the skin surface. They often show up on the face, neck, upper chest, or arms. While they may look harmless, having multiple spider angiomas, especially more than 5, can indicate liver dysfunction. They are caused by an imbalance of hormones, particularly excess estrogen, due to poor liver metabolism. The liver usually helps regulate hormone levels, so when it's damaged, vascular changes like these occur. Spider angiomas may also be seen in pregnancy or in people with high estrogen, but when paired with other symptoms like red palms, jaundice, or fatigue, they could suggest liver stress. They're painless but shouldn't be ignored if new and spreading. A struggling liver can affect your digestive system in surprising ways. One of the earliest signs is unexplained nausea, especially in the morning or after fatty meals. You might also feel full quickly or lose your appetite altogether. When the liver can't process toxins effectively or produce enough bile for digestion, the entire digestive process is disrupted. Nausea becomes frequent, food becomes unappealing, and even the smell of meals may turn you off. This isn't occasional queasiness. It's persistent and hard to pinpoint. If nausea and appetite loss come with bloating, fatigue, or weight changes, consider it a red flag. Support your liver with clean foods and hydration, and consult a health professional for proper evaluation and liver function testing. Sign 12. Brain fog and confusion. Your liver plays a key role in filtering toxins from the blood, including ammonia, which comes from protein digestion. When the liver can't keep up, these toxins cross into the brain, leading to a condition called hepatic encephalopathy. Symptoms may include memory problems, confusion, poor concentration, mood swings, or even personality changes. In severe cases, people may appear drunk or disoriented. This isn't simple forgetfulness. It's a cognitive fog that feels thick and persistent. Family members are often the first to notice these changes. If you or someone you love is becoming unusually confused, withdrawn, or slow in thinking, especially with signs of liver trouble like jaundice or dark urine, please seek medical help. Early detection can prevent permanent brain damage. So, let's bring this together. Your liver is an incredible organ. It wants to heal, it wants to regenerate, but it needs your help. That begins with awareness. If you're experiencing any of these signs, I encourage you to take action. Look at your diet, support your body with real, whole foods, and always consult a trusted healthcare provider for proper testing and guidance. And if you'd like to learn how to naturally detox and nourish your liver and kidney, go ahead and watch the next video on the screen. Don't forget to like, subscribe, and share this video with someone you care about. Together, we can spread the gift of natural health and healing. See you in the next video.